So there was an event in my life that inspired me to become a surgeon. When I was younger, my grandfather was an ophthalmologist, and every day after school, my parents would drop me off at his office, and so I really would just wander the halls, peek in on procedures he would be doing, flip through medical journals, stare at anatomic books and structures he had lying around. Everyone's life is shaped by events that they have. When I was younger, my brother was sick, and so he spent a lot of time in the hospital. And so I did see the way that the physicians would treat my family and my brother with a lot of care, and it made a big difference. And so that's something that I deliver to my patients as well.
I never forget my mother said, like the first year in college, you always wanted to be a doctor. I said, I didn't know that. I actually became a chemical engineer, knowing that one day maybe I wanted to go into medical school. It was kind of funny. I was getting jobs, trying to find jobs as a chemical engineer, but also applying for medical school. And I said, if I got a medical school, I would go. So when I got a year at medical school, I decided to become a doctor.
Actually, when I went to college, I was a business major to start. Having surgery myself, I changed over to medicine.
As a young kid, I just always wanted to help people. I was always kind of trying to make people happy. I'm a big people pleaser, and whenever anyone got hurt, I used to carry a little lunchbox full of Band-Aids and Neosporin. So I guess I was just kind of drawn to injuries from a young age. Blood and gore didn't bother me, and I just like to see the outcome of making people happy with a Band-Aid.
Growing up, my dad was an engineer, so I used to help him do some woodworking and building, and I really enjoyed using my hands to fix a problem. And so going into medicine, I always knew that I wanted to do some sort of surgery. I found orthopedic surgery because of a lot of things that I did with my father, were kind of translated into that. We got to use power tools and drills and actually fix broken bones. I focused on spine surgery because most people, whether they're young or older, are going to have back or neck pain. And so it's one of those things that can be really debilitating for people.
Played basketball in college, and in my senior season, I had a bad distal radius fracture, needed 2 surgeries, 3 or 4 months of rehab. And even through all of that, I was able to get back to playing. I actually sustained another fracture playing basketball in my other arm, had plates and screws, went through rehab. That was 15 years ago, and I still play 2-3 times a week. All of the experience with orthopedic surgeons and physical therapists have definitely inspired me and brought me to this point where I can share my own experiences with my patients, knowing sort of exactly how they feel.
During the high school, got really excited about taking care of people, and medicine was a natural follow-up to that. So I ended up in medical school in London, and what got me interested in surgery is the intricacy of the human body and how we can treat it, and especially the fine microsurgical aspects of hand surgery is what really drew me into that particular field.
I think I was most inspired probably from watching too much Operation Smile on TLC. I would watch all these videos of these mission trips and all these kids and their faces being repaired, and that sort of set me on the path to medical school.
I'm really lucky. My dad was an orthopedic surgeon, so I grew up seeing the stuff that he did, and frequently, like kids do, I followed Dad to work one time. And one time in the ER, I was helping him with someone that was probably about 3 or 4 years older than me. And this young man had a wrist fracture, and I helped my dad set the wrist. And I was hooked at that point, so I wanted to be an orthopedic surgeon from that point on. I was probably about 10 at the time.
I'm a second-generation orthopedic surgeon where I grew up watching my father take care of patients, and the interactions I saw between him and his patients and how it could greatly affect their lives were what got me to pursue a life of medicine.
Not a single event, I would say. My mom was a nurse for 4 years at Royal Oak Beaumont. She worked mainly labor and delivery, so she was very much in the healthcare field. My dad was an eye doctor, so definitely seeing growing up, a lot of the medical field and a lot of the on-call things. And I've always been interested in it, always been interested in helping people, interested in the anatomy of things. So I knew pretty early on that I wanted to be part of healthcare in some capacity or another. So I've known that for quite a while.